Hello and welcome to the lecture on bisexual and asexual health for week 4 of the summer 2022 LGBTQ health course. So let me get back to the correct slide to start. So today we will be talking through a few topics. We'll have an overview of the demographics of bisexual and asexual populations, followed by how to define and measure biphobia and aphobia, which is stigma against bisexual and asexual people. We'll then follow this by a brief overview of the health of bisexual and asexual populations, and then talk about intersections of identities between bi and ace people with regard to these two sexual identities, as well as with regard to gender. And then finally, we will wrap up with talking about asexual and bisexual community resources. So first things first, we'll start off with by the numbers. Who are bisexual people? So you may recall from earlier in the quarter, we had a presentation about the demographics of LGBTQ populations writ large. And this comes from the most recent Gallup polling data that focused in on identity as a dimension of sexual orientation and gender. And what the findings from Gallup showed is that first, 7.1% of all US adults identify as LGBT in some way, shape, or form. And when they did an in-depth dive to look at the breakdown of those identities, they found that 56.8% of all US LGBT adults identified as bisexual, which represents 4% of the overall US adult population. When you look at the finding of over 50% of LGBT people identify as bisexual, it is remarkably stable and consistent over time. So this was a meta-analysis of a variety of studies that was conducted by the Williams Institute. So it's a different source than Gallup, and I don't believe any Gallup data were included actually in this review. And what you see, though, is still over 50%, 52% in this study, in this meta-analysis, of people identified as lesbian, gay, and bisexual actually did identify as bisexual. This was a study that was conducted with binary sex and conflated sex and gender. So you see here that 33% of women and 19% of men, with no mention of people of other genders, are identifying. That's the breakdown of people who are bisexual. And if you look more in depth in terms of going back to the Gallup data, if you see who is bisexual, there's variations by age cohort, by race, ethnicity, and sex. And so here, if you look at the bisexual column, 15% of Generation Z, 6% of millennials, 1.7% of Generation X, 0.7% of baby boomers, and 0.2% of traditionalists identify as bisexual. You also see that women are more likely to identify as bisexual than men in the sample, and that the trends across other identities are, there's a lot of these, especially the earlier age generation cohorts, are going to be more likely to identify as LG and T and other than people who are a little in the older age cohorts, but that the breakdown between bisexual versus gay and lesbian and may shift to be more towards gay and lesbian people than bisexual in some of these older groups. It's not really certain why that might be the case. And there, of course, we do know that patterns of health disparities would indicate that people who are suffering from multiple chronic conditions and have an earlier onset of these conditions in life and have social determinants of health that are less favorable are going to have a shorter life expectancy, but that has not yet been disentangled to see why these trends might be true. Now, on being able to unpack beyond binary gender, not conflating sex with gender, we must look to the US Transgender Survey as a source for this at the intersection, to look at these intersections of sexual orientation and gender identity. So this was a study that was done in 2015, and it included people who identify as transgender. And what you see is that 14% of the sample said they identify as bisexual, 18% said they identify as pansexual, and 21% said they identify as queer. If you add that all together, that's higher than 50%. So again, that number, it seems to be consistent. Of course, not everyone who identifies as queer may experience multigender attraction. People may mean this differently from person to person, but oftentimes many people who do say they're queer might experience multigender attraction. At a minimum, 1/3 of the sample is bi and pan. And also 10% of the sample is asexual, which is relevant as we move forward in our discussion today. Next, if you want to look at the intersections between race, ethnicity, and sexual orientation, specifically through the construct of dimension of sexual identity, the Gallup data is only really broken down often by sex versus race ethnicity. They haven't really done too much reporting to look at within each LGBT letter what the racial ethnic breakdown is. But one trend that I want to point out from the Gallup data, however, is that white non-Hispanic people across all years of the data that Gallup collected are the least likely to be identifying as LGBT. That more people who are people of color, so Black non-Hispanic, Hispanic, Asian non-Hispanic, and other non-Hispanic individuals are more likely to identify as LGBT in some way, shape, or form. And then if we look, we can extend these findings. This graph, if you remember, the last one stopped at 2016. Here are some findings from 2017 moving forward through 2021. What you can see is that that non-Hispanic white adults are still, that's the green line here at the bottom of the graph, and that Black non-Hispanic adults and Hispanic adults are far higher, and that there's been increases over time in the percentage of adults in these racial ethnic subgroups who are identifying as LGBT, especially among Hispanic adults in this study. And there have been a variety of studies that I'm not going to share here because they're more convenient sample studies, or bisexual groups or LGBT groups have wanted to look at these intersections too of race, ethnicities, gender identity, sexual orientation, etc. And there are studies by Human Rights Campaign and other community groups that have found that bisexual people are very diverse, that many bisexual people are people of color and are transgender, and the intersections of all of these categories. And it's just important, I think, to keep in mind that bisexual people are not homogenous, that they are many, and that when we're thinking about what bisexuality looks like and what that is, it needs to be a variety of faces and bodies and ages that we're thinking about. So the data that I could find broken down at the intersections of bisexual people and by identity and by race and ethnicity, at least for the race and ethnicities of Black, Hispanic, and white, which tends to be the breakdown you see in many studies. And there needs to be more work looking at studies of bisexuality in Native American and in Asian and additional racial ethnic subpopulations. But what we can see here is that from studies using 2011 through 2013 data in the National Survey of Family Growth among people 18 to 44, 5.5% of women and then 2% of men identified as bisexual. And that you actually see, in contrast to the Gallup data, that and some of the data from communities, that white individuals were more likely to identify as bisexual than people of other races or ethnicities. If we break down the data in terms of behavior instead of by identity, first of all, you notice that these numbers are higher. 17.4% of women and 6.2% of men report any same-sex sexual contact in their lifetimes. Unfortunately, the data is not broken down in depth to be able to see people reporting both same and different sex sexual contact in their lifetimes. And you also see variation here where white individuals and Black individuals have nearly the same percentages of reporting same-sex lifetime sexual contact among women, slightly higher percentages of white individuals among men compared to Black individuals or Hispanic individuals. Among women, they're 11.2% report same-sex sexual contact in their lifetimes. By sexual attraction, as a dimension of sexual orientation, what you see is that many people who are reporting same-sex attraction in any way, so groups, the columns here from mostly opposite sex to equal, same and different sex, mostly same sex, and only same-sex attractions, that many of the people who report in these Kinsey scale-like categories are in the middle. And that's holding true across all of the different sex and race ethnicity classifications. So In summary, approximately 4% of all US adults identify as bisexual, according to the most recent data published by Gallup. If we look at some older data that goes more into these dimensions in depth of sexual behavior and identity and attraction at the intersections of sex and race ethnicity, what you can see is that 6.2% of men and 17.4% of women are reporting same-sex sexual contact. And then if you look by attraction, it's 16.9% of women and 5.8% of men report multiple sex sexual attraction. And this is in contrast to only 8.8% of same-sex only attraction for women and 1.5% of same-sex only attraction for men. So obviously there are some weaknesses in the data reporting systems that led to the reporting of these findings. They tend to be focused on a limited subsection of people of various races and ethnicities, and they don't differentiate sex and gender. So it's very difficult to see findings by the different dimensional breakdowns for the intersections of bisexual people and transgender people. But still, I think overall, what the studies tend to show is that bisexual people are many, they are diverse, and that they are, the term invisible majority, which is the title of one of the optional readings that was assigned for this week for bisexual health, is quite apt. So next, going to look in the demographics and numbers in depth for asexual people. So we've talked about this study a little bit in the class already, which is a study by Bogart and colleagues in 2004 that was a nationally representative probability sample in Britain that was done. And this study found that in 2004, just over 1% of all people in the UK in the study, or in Britain rather, in the study, reported they had never been sexually attracted to anyone at all. So here, the dimension of asexuality that's being measured is lack of sexual attraction. If you look at the variety of other studies, there's been no others that have used robust methods in terms of being nationally representative probability samples. But if you look at convenience samples or samples of specific subpopulations, in this case, the National College Health Association's survey that was from spring of 2017, I'm showing this because depending on the survey, this NCHA conducts surveys both in the fall and the spring every year. Sometimes they change the way they ask the questions around sexual orientation, and it actually has made it harder in some of the later years to look at a breakdown that's inclusive of asexuality in this way, bisexual identity. But in the surveys that have done this and allowed for this type of a more granular breakdown by sexual orientation, you can see that, of course, the majority of students report being straight or heterosexual, just under 80% in 2017 in this study, but that if you look at among the sexual minority groups, bisexual students are the largest sexual minority group, followed by asexual students as the second largest. And I think this is quite remarkable. It goes against the grain, definitely, in terms of what the mainstream media and even LGBT media talks about as who LGBT people are. If you look in depth, especially among younger people in this sample, which is this College Health Association survey is typically among people 18 to 24 years old, you're really seeing large percentages and the majority of LGBT people in the sample identifying as bi and ace. So next, I wanted to share a breakdown. This was a study that was published in 2015, applying the multidimensional model of sexual orientation specifically to people who are asexual. And what the study found is that within the sample of people who could be considered in the asexual community through AVEN, and they found that 71% of people said they identified as asexual, 68.2% said that they did not experience sexual attraction, and 48.5% said they did not engage in sexual behavior. And then you can see the various intersections of these identity, attraction, behavior here. And about 1/3 of people in the sample said, I identify as asexual, I don't experience sexual attraction, and I do not engage in sexual behavior. And so what you see is actually a lot of diversity then in terms of these intersections about what it might mean to be included in the ACE community in some way. And so next, I wanted to talk about biphobia and acephobia because, while demographics are important to know who bi and ace people are, we need to be able to look more in depth at what the impact of that is socially. One more thing before we do that, I wanted to say I'm not giving a breakdown here of race and ethnicity or of age or additional characteristics really in the asexual health section, because there have been far fewer studies published on asexual people to be able to try to give a breakdown like that. It's just not been published, and many times the questions on asexual orientation in any way are just lacking. But anyway, back to thinking about structural factors and the consequences of being bisexual or asexual in terms of a social stigma landscape. So what is biphobia? Biphobia, very simply, can be defined as the dislike or prejudice of bisexual people. It exists on multiple levels, as we've gone through in some of our conceptual models earlier in the class, like the socioecological model, for example. Biphobia exists on the structural, interpersonal, and individual levels. And it's very important to note that bisexual people are also impacted by homophobia. And so that would be dislike or prejudice of people who are identifying as gay or lesbian, or who are experiencing same-sex attraction, engaging in only same-sex sexual behavior, etc. So both biphobia and homophobia are going to impact in terms of a social stigma perspective bi+ people. So some of the examples of biphobic stereotypes include that bisexual people are confused, are greedy, are promiscuous, are disproportionately spreading sexually transmitted infections, are cheaters, they can't be monogamous, they all have high libido or are hypersexual, are untrustworthy or liars, and saying they're bisexual only for attention, not because they're like really bisexual. And they are saying bisexual because it's easier than saying they're gay, and that perhaps they're saying bisexual so that later on they're going to come out as gay. It's like a bridge, like a transient identity, etc. And that bi+ people are required to pick a side. So related to that, there's this idea that bisexuality is just a phase, and that basically that especially if you're a man, there's this idea that you're actually gay. If you're a woman, there's this idea that you're actually straight. There's this other weird idea that rather than being bisexual, you're actually parts gay and parts straight. So like as a bisexual person, you would be comprised of sexual identities that are anything but your own. There is this idea that bisexual people must be 50-50 attracted to people in that model. It tends to come out of a model where sex and gender aren't defined differently and they're binary, which is also problematic. But anyway, there's this idea too that because bisexual people are only part gay and they're also part straight, that they would have heterosexual privilege instead of being impacted by biphobia and homophobia. There's this idea that identifying as bisexual is a transphobic identity label, that somehow when you say you're attracted, even if you are a bisexual person who says I'm attracted to men and women, that you must only mean cisgender men and cisgender women. I would argue that conceptualization is what's transphobic, not saying you'd be attracted to people who are men and women, and could, because I would say men and women could be of any gender modality. Anyway, there's this idea also that if we go back to the definition of bisexuality revisited in our very first lecture, that bisexuality just means you're attracted to people of more than one gender. That somehow within that definition, some people think that you must be attracted to men and women as two of those genders. There's this idea overall that bisexual people are just wrong in their identity label. It's definitely something else. Maybe it's not your real sexual orientation, et cetera. Like all these things kind of play into that one. There's this idea too that people should be able to administer their own individualized tests to say if you're really bisexual or not, that somehow there's like imposter bisexuals out there. I'm not really sure what to say about that one. There's also this idea that if you're bisexual, that's the only identity label that you can use. And this comes up especially in the context of what are sometimes been called the label wars. So actually many bisexual people identify with, many people in general might identify with more than one sexual orientation identity. So it's not uncommon at all for people to say I'm bisexual and queer, or I'm bisexual and pansexual, or I'm pansexual and queer, etc. So this idea that you have to, again, it's kind of like pick a label, pick a side. If you're not doing that you're not really bisexual, and anything that comes down to you're not really bisexual is going to be an example of biphobia. So, and last but not least, I just want to go through, look at these lists. There's a lot of stuff here. And then sort of strangely, one of the other stereotypes or parts of biphobia is actually bisexual erasure, which is this idea that bisexual people don't exist at all. So I think it's really weird, ultimately, because how these things could exist side by side, because that's a lot of knowledge that's out there about what bisexual people are like, to have at the same time a belief that they don't exist at all. And it's actually quite mentally upsetting if you think about it. What are the implications of that? Here's all these bad things that you are, and you can't be, you're anything but who you say you are, and you don't exist. Like, what? Okay. And the New York Times actually, I think, I don't remember if it was 04 or 07, they ran a headline that was specifically about bisexual men that was reporting one of the findings from J. Michael Bailey's early studies about bisexual men, which said actually bisexual men don't exist, in his early work with plasmography. And the headline was "Gay, Straight, or Lying." So that headline directly pulls on this idea, that biphobic idea that bisexual people are liars. Overall, though, this idea that bi people don't really exist is called bisexual erasure. And bisexual erasure is widely manifested throughout society, including within research contexts, healthcare law, and even in LGBTQ policy and activism and social grassroots community organizing movements. So biphobia has, in fact, been so well studied at this point and well documented, according to some of those stereotypes that we just went through, that there have been validated survey measures that have been created to assess biphobia in research studies. And so a few of them are mentioned here. And next, I wanted to jump into acephobia, which is sometimes called aphobia. And what it really is parallel to biphobia. It's in this acephobic definition. Acephobia is the dislike or prejudice against asexual people and people on the asexual spectrum. Just like what we saw before, the socio-ecological model as it applies to stigma is true for acephobia. So acephobia exists at structural, interpersonal, and individual levels. Some examples of acephobia is that all asexual people are celibate, are sex negative, don't have any libido, are unnatural, because sex is assumed to be natural, so asexuality is assumed to be unnatural. There's this idea that ace people aren't queer. You just haven't met the right person yet. The asexual people would also be aromantic or wouldn't experience romantic attraction, even though they don't experience, that they're just, you know more about asexual people than they've told you just by knowing about asexuality. There's this idea that people who are asexual are all in fake relationships. Again, that also ties to assumptions about whether or not asexual people would be engaging in sexual behavior, which, as we saw in that Venn diagram, many do. There's this idea that all ace people would not want to be in a sexual or romantic relationship, that they all don't have sex, and that they all don't masturbate, that there's just no sexual behavior of any kind that would go on with asexual people. And the corollary to that is, and if you do engage in that, you're not really asexual, would be something that people might say. And again, anything that invalidates somebody's identity, experience, etc., is going to be an example of acephobia, just like with biphobia. There's also this idea that asexual people are just sick. They must have a disease or a disorder. There's, in fact, been histories, just like within the history of the DSM as it pertained to saying homosexuality and bisexuality were mental health disorders. Hypoactive sexual desire disorder for many years was classified, and it still is classified, as a pathology in the DSM. But then asexuality was carved out of that to remove it as a pathology much later on, thanks to the activism and advocacy of David J., who is the founder of the Asexual Visibility Education Network, as well as many colleagues who worked alongside David in coalition to get that to happen. There's this idea that we saw again, just with our most recent assignment, there's this idea that asexuality, like all other non-heterosexual sexual identities, would be caused due to trauma or abuse. So trauma, or in particular sexual trauma, must be the root cause of a person's asexuality. There's this idea that all the ace people are frigid, are prudes, don't desire any forms of intimacy or touch in general. There's an idea that, if you're asexual, how in the world could you be polyamorous? Because the idea of being in a romantic or loving or sexual relationship it was out of the idea of what most people are thinking about asexuality. So having more than one relationship, definitely a stereotype is that can't happen. In fact, there are these stereotypes at the bottom here that perhaps asexual people can't find anyone to have sex with them, and that's why they're asexual. There's this idea if asexual people are conventionally physically attractive, that sometimes people say you're wasting your attractiveness. What a waste. Not a great thing to hear. There's another similar to bisexuality that ace people are saying they're ace just to be different because they are begging for attention. And then also similar to bisexuality, some of these stereotypes here that ace people are actually all heterosexual, and that therefore they also all have heterosexual privilege. This, of course, denying the fact that they are asexual. And it is possible, as we'll see in some of the intersection of identities conversations, to be asexual and heterosexual. But that does not mean that you would have heterosexual privilege in terms of looking at the impact of acephobia on the structural, interpersonal, and individual levels of how stigma affects health. So also parallel, last but not least, there's this idea that asexual people don't really exist at all. That maybe even if you don't have a high sexual desire, or you have low libido, or you don't, you're not really attracted to people, that's asexuality is not a thing. We're going to just deny its existence. You can't identify as asexual. There isn't really a popular lexicon to describe this phenomenon, but I think because of its similarities to what I've seen and how asexual people are stigmatized and denied, having their existence denied, I would call it asexual erasure. So that's what I put in the slide here. And there's not much work around acephobia or the mental or physical health and well-being of asexual people, but there has been published in somebody's dissertation research. A measure of acephobia was generated, the asexual microaggression scale, and what you can see here is many of those stereotypes that we just talked about as belonging to domains of acephobia are in the measure. So other impacts of acephobia and biphobia. This is LGBT Funders for LGBTQ Issues puts out an annual portfolio assessment, and in many of those portfolios, for different years, they have looked at the breakdown of funding by different letters within LGBTQIA communities. And what you can see is that bisexual people make up less than 0.1% of all dollars that were funded to address LGBTQ people in any way. That in this year of 2018, that $226,978 were found to be granted out of over 200 million, over 200 million. And that these numbers are consistent year by year. Some years, actually, this dollar amount is zero. And the dollars that are dedicated to bisexuality tend to be from one institution, the American Institute of Bisexuality, and they fund J. Michael Bailey and other researchers to conduct studies that really ask, does bisexuality exist? Can we prove it? I'll leave it at that. What it shows in that regard, especially, is a lack of community funding to dedicate to bisexual equality, rights, health, anything really, from a community or a grassroots perspective. And you'll notice that asexual people are not in this report, and that is because funding to asexual people and populations has never been tracked by funders. And I think it hasn't been tracked likely because there would be nothing to report. And also, in breaking down the LGBTQ undedicated, what we find is that there's a lack of focus on bisexual people in those dollars too. And that is actually paralleled within the NIH, the Sexual and Gender Minority Research Office's funding portfolio breakdown that they put out annually. So for fiscal year 2018, what was found is that there were 384 projects that were classified as SGM Health by NIH. Then they did an in-depth review. They found that 55 projects, or 14.3%, could be classified as bisexual related in some way. But when I pushed NIH to break this down further, because they initially released a version of this report and then revised it based on a critique, they found only 7 of those 55 projects were bisexual specific, meaning that the project said that they would be doing analyses that would distinctly focus on the outcomes of bisexual people. And of those 7 projects, only 2 of them were focused really on bisexual health in particular. So like this is a project recruiting bisexual people, focusing on bisexual health within these populations, a dedicated bisexual health study. 2 out of 384 studies met that criteria. And so that's less than 1%. And if you do a similar type of deeper dive into analyses of what our community funder is funding in the LGBTQ context, you see similar patterns, which is a lack of focus and care on the health of bisexual people. And asexuality is not represented at all within the SGM research portfolio analyses. I don't believe in any year. So obviously, what you'll see here, there's funding challenges. We know there's stigma against bisexual and asexual people. So what are some of the things that have been found with regard to the health of bisexual and asexual populations? So here is a summary that was taken. This is adapted by a conceptual model of the minority stress model by Mark Hassenbuehler. What you can see here is that stigma is feeding into stress, anxiety, depression, poor mental health, which then feeds into health disparities and equities, not just for mental health, but for a broad variety of health conditions. And so that's the model that generally also is thought to drive poor health outcomes in bisexual and asexual populations. And I also want to point out, I talked about this a little bit earlier, that of course I said bisexual people are subject to both biphobia and homophobia. And also their bisexual people are exposed to biphobia not only in mainstream society, but also within LGBT communities. So this is actually from the paper that you read, and I just made a graph showing the anti-bisexual experiences score that bisexual people reported from both heterosexual and gay and lesbian people. And while you can see that technically in the paper discusses this, that the levels of biphobia that heterosexual people report, or that bisexual people report feeling from heterosexual people or experiencing from them, is technically a little bit higher than that for gay and lesbian people. It doesn't look that different to me. The other thing that you'll see, I think you see this a little bit in Robin Oak's article, Without Wincing or Clenching, and certainly more broadly in bisexual community discourse, that when bi plus people experience biphobia from gay and lesbian people, it feels like a betrayal in a way that sometimes you might be expecting to experience stigma from heterosexual people, but then if you're not out and you haven't spent a lot of time in LGBT communities, the first time especially you experience biphobia from a gay or a lesbian person is like a slap in the face, because you realize you're not wanted anywhere, is what it feels like. And that also really speaks to the need for bisexual specific community organizations and advocacy, because biphobia is pretty much everywhere you look at every turn. That's also talked about a lot in the Invisible Majority report by Movement Advancement Project, which is an optional reading. So I'm not going to go in depth through all the different studies here. I think I'll probably post some additional optional papers for people as resources to read through some of the systematic reviews and meta-analyses that have been done that have shown wide-ranging disparities among bi plus people, often not only in comparison to heterosexual people, but also gay and lesbian people. And with regard to permanent health outcomes, depressive symptoms, anxiety, as well as suicidal ideation, planning, and attempt. Alcohol and substance use, tobacco use often are exacerbated in bisexual communities compared to people of other sexual orientations that are monosexual. We've seen this slide, I think, in the previous study that we had on intersectionality in health and LGBTQ populations, but I wanted to highlight here. So this is looking at intersections of bisexuality, sexual orientation, sex, race, and disability. And what you see here in terms of the percent of the people reporting functional limitation, that bisexual white females and bisexual non-white females are at the very highest, experiencing the very highest levels of disability that was found in this study, which is from the National Health Interviewing Survey as the sample. And then you can also see within the groups that have similar social position in terms of, here we're looking at gay non-white males compared to bisexual white males, and then bisexual non-white males. Like you're seeing again some of these trends where bisexual people, bisexual men in this case, are going to be experiencing worse or still experiencing heightened levels of disability compared to people of additional other sex, race, and intersections. So when we look at chronic conditions and mental health, this is using the National Health Interviewing Survey data set. Again, what we see is among men that bisexual men are experiencing, compared to heterosexual men, are experiencing high levels of moderate and severe psychological distress, and that these numbers, the confidence intervals overlap, but are also, it's pretty close to, especially for moderate, that you see that these odds ratios are at least higher for bisexual men compared to gay men. And then if you look among women, you see again that you also, in addition to mental health, you see having multiple chronic conditions, that bisexual women are more likely than heterosexual women to report having multiple chronic conditions. And again, the severe and moderate psychological distress are higher in bisexual women compared to heterosexual women. You can see these odds ratios are also higher among bisexual compared to lesbian women, even if there isn't a statistical test to compare the groups. So in addition to thinking about mental health, chronic conditions, psychological distress, et cetera, and extending into sexual and relationship violence, you can see the most comprehensive and high quality study in terms of being nationally representative conducted by the CDC. The NSVIS found extremely high levels of rape, physical violence, and stalking, actually across the board. But if you look at specifically the breakdown of sexual orientation, 61.1% of bisexual females reported rape, physical violence, and or stalking in their lifetimes. That's 37.3% of bisexual adult males reported that high prevalence of rape, physical violence, or stalking. What you'll notice is, first of all, these are the highest numbers within the respective sexes that are where this was considered. And you'll also see that the percentages of bisexual men reporting rape, violence, and stalking is actually higher than that reported of heterosexual women, which is who I think we often think about as being subject to these endemics if you're like thinking of a broad mainstream society or media reporting, et cetera. And then also, if you look in TransPop and the US transgender surveys, you see that very high percentages of people, of transgender and non-binary people, are reporting physical or sexual assault. But those intersections here with sexual orientation are not broken down. But we do know that based on these numbers, it's very likely that you would see perhaps heightened levels of violence impacting transgender and non-binary people, and that these numbers also are higher among Black and Brown people, and also Indigenous people compared to white people. So what is going on with why, like how does biphobia and how does acephobia, et cetera, how do they exacerbate poor health outcomes? And there's not been as a lot of, despite more and more studies showing that for many health conditions, but not all, that bisexual people are experiencing worse health outcomes compared to gay and lesbian people, and as well as, of course, heterosexual people. That, figuring out why that is has not been looked into as much. There have been a variety of papers that have attempted to look at developing bisexual minority stress models and trying to see the unique impact of biphobia on health. There's been some work that's been showing that stress leads to isolation and loneliness, which then can enhance at least poor mental health. There's been very limited work on the impact and association between biphobia and poor physical or chronic health outcomes. And more of that needs to be done that tries to look mechanistically. And that's honestly where a lot of my own studies are focusing. So getting into asexuality and health, there's much less published. I mean, there's not enough published on health outcomes of LGBT populations writ large, let alone going in depth into any of the letters, and especially if you're thinking at the intersections, multi-level, social epi, it's just very limited, right? But asexuality and health may be, and also intersex health, I think, are the most limited topics of health that are reported by subpopulations of SGM people. So there's just a handful of studies. There's a study that was done using the Healthy Mind Study data that found that asexual college students were more likely to report a history of PTSD as well as sexual trauma than non-asexual individuals. But the interaction between asexual identification and sex for these outcomes was not significant. If we go back to the Bogart study from 2004, they were looking at health from a very broad definitional perspective. So adding up items, looking at for your age, would you describe your state of health as, from very good to very poor? Do you have a permanent disability? Do you have a long-term medical condition? Kind of like looking at chronic conditions here. And then in the last 5 years, did you have any accident or illness that affected your health for at least 3 months? And then the last 3 health measures were recoded so that poor health had high scores, and the mean of the 4 health measures served as an aggregate variable of health problems. So knowing that, looking at this, the differences between asexual people, and here this says sexual, pretty much the term that's come to be quite common now rather than sexuals is allosexuals, especially within asexual communities. So you see that there was a significant difference between asexual and allosexual people in the study as it came to health problems, with asexual people having a higher burden. There's also, in the discussion of the paper, the authors note that when social class and education were eliminated from the regression equation, health was significant, suggesting that socioeconomic issues may be impacting the health of asexual individuals, especially among women. So that would be consistent, again, with a minority stress perspective about how stigma and stress can be then filtered into poor health, in this case, also through perhaps effects on socioeconomic status, which is often what happens with when you are discriminated against. It often has SES effects. Interestingly, in the study that was done for Population Assessment of Tobacco and Health, or PATH, as it's sometimes called for short, there's not actually observed substance use disparities in asexual people compared to people of, looking at, especially defining asexuality with regard to, I think this was attraction. And what you're seeing here is that, like for tobacco use and any tobacco, cigarette, e-cigs, cigars, pipes, hookahs, smokeless, etc., asexual people in many of these categories were significantly less likely to use tobacco. And that this was true among U.S. adult women as well as U.S. adult men, that these patterns held true. And this stands in contrast to, especially if you're looking here among women, you're seeing that for people reporting multi-gender, well, it says both sexes, but that's because it's binary sex in the study again. You're seeing, kind of, this would be more of like the bisexual proxy. This would be like the gay lesbian proxy. This is a hetero proxy. That you're seeing higher odds of tobacco use of various types in these sexual minority groups, but not for asexual people. But then, so that's a study that was done, with tobacco use within PATH. But then if we start looking at mental health, we start seeing some different effects. And so in asexual populations, this was the ACE community survey. In 2017, we had done an analysis, partnered with AVEN and the ACE community census teams to do some analyses of looking at mental health outcomes within a unique way of constructing sexual orientation. So the ACE community census asked people to describe, asked about asexuality, and everyone in that sample pretty much is identifying as asexual in some way, shape, or form, or ace spectrum. So like either asexual, or gray asexual, demisexual, etc., are going to be in the sample. And then within that, they asked people to identify any additional sexual identity labels that they felt applied to them. And so we constructed this sexual identity measure, where we looked at what we called non-ace identities at the intersections of asexuality. And there you can see then the distributions of people reporting a mental health professional had diagnosed them with depression, or they reported having suicidal ideation plan or attempt. And what you can see here is that, so here is people who are ACE only. So they said, no, I'm asexual. I don't use any other label within this ACE community survey sample. And then that's in contrast to people who said, I am asexual and straight. asexual and gay, asexual and lesbian, asexual and bisexual, asexual and pansexual, asexual and other, asexual and questioning, etc. Is the way the sexual orientation measure was constructed. And what you see is that ace-only people have a higher level of depression, reporting depression, than people who are ace and straight, and that people who are ace, gay, lesbian, bi, pan, use another label or who are questioning, or sorry, just the other label, actually have higher levels of depression than people who are ace only, and that people who are questioning are pretty much alongside in between people who are ace and straight or ace only. This pattern holds true across all of these mental health outcomes or suicide-related outcomes, as you see here. So, and also you see this difference between diagnosed depression, and then those numbers are actually lower than people reporting suicidal ideation, which may reflect a lack of access to healthcare, which again, be consistent with minority stress model, right? And you see that suicidal ideation is very high. And that if you look at plan, it's lower than ideation, but still high. Attempt is lower than plan or ideation, but still these are striking numbers compared to the overall national averages that you see, which are much lower than what you see in this population of ace only. And people who are ace and straight, like even these numbers are higher than what you see in straight people who aren't LGBT or ace in any way. And then if you look at the intersections, so everyone in the study is ace in some way. You're looking at this ace population at the intersections with gender identity. And gender identity was constructed in 6 categories: cisgender man, cisgender woman, transgender man, transgender woman, non-binary transgender, and non-binary people who don't identify as transgender. This was based on the merging of 2 questions together to create this construct, which Dylan will talk about actually in her lecture in much more depth. And so what you see here, again, very high levels of depression, suicidal ideation, plan, and attempt. And looking at transgender people, 85% of transgender men, 76% of transgender women, 76% of non-binary transgender people, and non-binary, not 70% of non-binary not trans reporting suicidal ideation. Those numbers are also very, very high. Those are similarly high numbers, although with trans men being the highest, as what people are reporting for gay, lesbian, bisexual, pansexual, and other identities in the study. So then if we look at the odds ratios, this just, you can see that straight people within when we were adjusting for age and race in these odds ratios, that people who are ace and straight have lower levels of diagnosed depression than people who are ace only, which is our reference group. And you can see these disparities patterns that we just talked about across these mental health outcomes in asexual people in this ACE community survey data set. And so overall, the limited evidence that we see out there would tend to suggest that asexual people are experiencing higher levels of poor mental health, that this could be due, that there's asexual microaggression scale out there, and I think more studies need to use scales like that to then connect asexual minority stress characterizations into mental health and eventually also physical health outcomes to better characterize how the minority stress model plays out in asexual populations. At a minimum, also, I would say there's been this study and other studies that have found poor mental health and higher levels of mental health burden. I had done some very underpowered analyses that might suggest diabetes could be higher in asexual people that I'm not showing here. And I just think much, much more work needs to be done. And across the board in sexual and gender minority communities, we need more work at the intersections of race and ethnicity, because we don't look at race and ethnicity. We look at them as proxies for the effects of racism, et cetera, on health. We have, of course, that conceptual model that also positions that in relation to resilience promoting factors. More and more work mechanistically according to conceptual models that are going to be in alignment with communities' norms and conceptualizations of themselves are going to be very important to understand why we see these patterns of health disparities that impact LGBTQIA+ people, including bi and ace people. Lastly, before I start jumping into the community resources, I wanted to just unpack more explicitly using examples of people either from real life narratives that you can even find in your first person readings, or just some examples that I constructed actually for a CDC training on bisexuality and asexuality that I gave a few months back, to show how the intersections of sexual orientation and gender identity can look within bi and ace people. So here I have some examples of overlaps between sexual orientation, identity, and attraction related to gender. So here I wanted to just do some brief narrative. So I say Chikulu is attracted to men and women. And for Chikulu, men and women means cisgender and transgender men and women. Chikulu identifies as bisexual. Jake is attracted to non-binary and agender people. Jake identifies as bisexual and queer. So this is possible because this definition of being bisexual just means being attracted to two or more genders. In this case, the two or more genders are non-binary and agender people. And so that's an example of a bisexual person who's not actually attracted to men or women in that case, but still is bisexual and also in this case queer. Flora is attracted to non-binary people and women. Flora identifies as a bisexual lesbian. This combination of identity terms is not common in people who are older, but is starting to emerge, especially in youth populations and youth in adolescent people in high school, even middle school might be using some of this lexicon, and that can vary at different parts of the country too, with how common this is. But we are seeing this emerging in different areas and age cohorts. And also, last one, gender is not a defining factor in Lee's sexual or romantic attractions to other people. Lee identifies as both bisexual and pansexual. So a lot of times people think of this definition of, oh, gender's not a factor for me, I just like everybody, like people. They'd say, oh, that's pan. Well, it can also be bi. And in this case, both, right, for Lee. And of note, Robin Oakes is somebody who identifies as both bisexual and pansexual. I would be an example of a person who would only identify as bisexual, but this definition fits me. And we'll go into a little bit more about why that is in a second. So next thing I wanted to cover that actually comes out a lot of the asexual community lexicon is the split attraction model. And so the split attraction model means that you can experience romantic attraction differently than you experience sexual attraction. It is possible to be sexually attracted to other people, but not romantically attracted to other people, in which case you would be allosexual and aromantic, or vice versa. You might be somebody who does not experience sexual attraction, but who does experience romantic attraction, in which case there's 4 possibilities. I'm going to probably screw this up. But anyway, you can be allosexual, aromantic, allosexual, and romantic. You can be asexual and aromantic. You can be allosexual and aromantic, etc. Like there's all these different ways you can identify, and that's tied into the split attraction model. But if we dig down into what the split attraction model might mean in terms of bisexuality and asexuality, or in these different combinations, I just wanted to point out it's possible to identify with the bi plus label and with an asexual or aspectrum identity in the split attraction model. So depending on how people are experiencing sexual and romantic attraction, they might say I'm a biromantic asexual person, meaning I don't experience sexual attraction, but I do experience romantic attraction to people of more than one gender. They may also say something like I'm a panromantic gray asexual person. This person would be somebody who's saying that the romantic attraction, they might be romantically attracted to people of all genders, or gender may not be a factor for them and their romantic attractions. And that gray asexual means that sometimes they experience sexual attraction and sometimes they don't. And then it's also possible to identify with a bi plus label and a romantic label or a spectrum identity. So you can be bisexual aromantic or pansexual demi-romantic, like we were talking about at the beginning of this slide. So I also wanted to point out this intersection, which is that if you don't experience sexual or romantic attraction to other people, that one way you can think about this in terms of identity is that gender is not a factor in defining attraction, because how could it be, since the person is not experiencing attraction at all in one or more dimensions, either romantic or sexual attraction. So many bi and pan people, as you already know from this discussion, report that gender is not a defining factor in their attraction to other people. This isn't true for everyone, though. And so because of this overlap, it is very possible to be bisexual and asexual. Asexual in that you don't experience sexual attraction to other people, and asexual, so that's asexual, and bisexual, and that you might still be wanting to have relationships, including engaging in sexual behavior, as we saw again from that diagram, with people of more than one gender. So the way that you might get to sexual desire, sexual behavior, isn't through the pathway of sexual attraction. That is possible, and it does exist in people. And so you can be actually both bisexual and asexual without having to say, I am bi-romantic and asexual. Like, you can truly be bisexual and asexual, and there's no inconsistency in what that might mean. There might be, I think, if somebody is identifying with any label, actually, you need to ask them what it means for them in terms of their sexual orientation and their gender to really understand it, because there's so many bisexual people, so many ways, so many trans people, so many ways, so many bi trans ace people, so many ways, right? Like, you really, if you want to understand what somebody means when they talk to you about who they are, you really need to have a conversation, because you can't assume things from one word that people tell you. There's a lot of variation in people's existences and identities and lives. In terms of, being labels are helpful to help identify where you're at and how you position yourself, but they also don't to say everything there is to know about you. So this is actually from, I think, an article that should be posted in our first person readings. And the title is Being a Bi-Gray Asexual Means Continually Redefining Desire Away from Limiting Social Constructs, just published on the Black Youth Project's website, authored by LaTanya Pennington. And so LaTanya says here, tells a story about how it was easy, while questioning made it easy for me to embrace being a gray asexual. Internalized biphobia and an uncertainty about sex made it hard to embrace being bi, even though I had claimed it for myself. Not only was my brain stuck on a wrong definition of bi that enforced gender binaries and being sexually active, but an uncomfortable family Thanksgiving in 2018 put me on the end of biphobic comments and made me even more ashamed of using the term for myself. And so basically, this person is talking about how they felt trapped by binaries in multiple ways and what that was like for them. And they specifically are talking about Thanksgiving, and they're talking about sex was taboo for me, including, in part because of slut shaming, being raised by a strict Black father and a Vietnamese mother, and receiving abstinence-only education, sex education in school as a person of color. So there's a lot to unpack here. This is this particular person's story, LaTanya's story. And what I really like about it is it talks about the intersections in many ways around bisexuality, asexuality, being multiracial, being Black, being Asian, et cetera. And so, and how that was being unpacked in the context of family and coming out. And then for this, this story, I generated this one, but the story was, I'm a bisexual, ace, non-binary, transgender person. So Matt in this story or example is a multiracial, non-binary trans person who does not experience sexual attraction to other people, but does experience romantic attraction to people of multiple genders. They also experience sexual desire for other people, but gender is not a defining factor in how their sexual desire plays out. You can see that this example says that Matt does engage in sex with the romantic relationship partners, and that their partners have been a variety of genders, and that because Matt experiences multi-gender romantic attraction and has sex with romantic partners, so sexual attraction behavior coming up here, that they also identify as both asexual and bisexual. So this is in the dimension of sexual identity. And this person can therefore is non-binary, transgender, bisexual, and asexual all at the same time. And none of these identities are in conflict with each other. It's very important to point out, like we already saw with the US Trans Survey, that many trans people and non-binary people too are bisexual and are also asexual. Many studies, though, do not allow people to pick more than one sexual orientation label. Not even within LGBTQ community contexts and surveys is this allowed. And so I would argue that it flies in the face of how many people actually experience their sexual orientation and their gender identity to limit choices either for sex or sexual orientation or gender in survey research. That if you really are trying to understand how people are constructing and describing themselves with regard to SOGI, you need to let there be a check all box that people can choose. So that also has implications, of course, for the design of measurement design in health research for sexual and gender minority people. And I really think the entire field needs to be shaken up to understand how people are constructing and talking about who they are, and be able, and sometimes it's actually a pretty simple switch, especially if you're doing work that is rooted in LGBTQIA plus communities where some of these terms have increasing salience, like asexuality has gotten a lot more media attention, especially in the last 10 years. And so more and more people, especially if they're LGBTQIA, understand what asexuality is, and especially if they're younger. I think it's pretty inexcusable not to be offering surveys that ask about sexual identity that include asexuality as an option, or at a minimum, if you don't want to do that, you have a separate standalone question that asks about asexuality, as well as asking questions along all dimensions of sexual orientation by identity, behavior, and attraction at a minimum. So that brings us to the last section of our discussion today, which is bisexual and asexual community resources. First, I'll go through BI+ community infrastructure. So there are a variety now of 501c3 organizations in the United States that are focused on bisexual plus people and communities. These include the Bisexual Resource Center, Bisexual Organizing Project, Bi-Queer Alliance Chicago. These are the community-focused ones. AIB, or American Institute of Bisexuality, is a funder. They tend to be funding academics and they actually don't fund any community research led by people who aren't academics. There's also, new is maybe a misnomer at this point, PAVES has been around now. Polyasexual Alliance for Visibility, Education, and Support. It's based out of Colorado, has been around for maybe 7 or 8 years now. The Los Angeles Bisexual Task Force has received 501(c)(3) status also in the last 5 to 10 years. Bi+ Georgia received, which is based in Atlanta, received its 501(c)(3) status, I think within the last 3 years, actually. And then there is a group that is called Bi+ Tennessee, that's based in Nashville. It's one I helped to found. It's not a 501c3 organization, but it is incorporated as a nonprofit in the state of Tennessee, making it the first Bi+ incorporated nonprofit in that state. And then there are also bisexual health-focused campaigns that are led by these Bi+ community organizations. Bisexual Resource Center has hosted the Bisexual Health Awareness Month since 2016. So it's going into its 8th year in 2022. It's a social media campaign. Then there's the Bisexual Research Collaborative on Health, or BIRCH, which is basically a Facebook page at this point where people who are academics who study bisexual health can congregate and network. In 2019, for the very first time, the NIH hosted a workshop on bisexual health research. It was chaired by Drs. Brian Dodge and Wendy Bostwick, who were 2 of the co-founders and leaders who co-founded BIRCH. I also had the privilege to be there and to speak. You can watch this on YouTube. It's still available. There's the Chicago Bisexual Health Task Force, which I helped to co-found in Chicago. And we really partner a lot with groups across Chicago and that are LGBT or HIV focused, as well as groups nationally, like we've participated with Bisexual Health Awareness Month and the Bisexual Resource Center, et cetera. Then there are some notable holidays. So September 23rd is Celebrate Bisexuality Day. December 8th is Pansexual Pride Day. March is Bisexual Health Awareness Month. And there's also the Because Conference, which is the Bisexual Empowerment Conference, a uniting supportive experience. And that is hosted by Bisexual Organizing Project. And the month sometimes varies. I think they'll be doing it in October this year, is when they did it last year. In the past, it's been in April. So those are just a few things. There's also the Visibility Impact Fund, which is a group that started in September 2020. I helped co-found that. It is the first grassroots BIPLUS giving circle and grant-making institution that's really seeking to expand the capacity of BIPLUS organizations to receive grant support, as well as supporting LGBTQ organizations that are focused on doing bisexual programming. So we actually are going into our 4th round of grant making, and those grants are due today, strangely. So those are some of the infrastructures in terms of community that are available for BIPLUS communities, focusing on the US, obviously. There's also international resources that I won't cover here. And then asexual community health initiatives. So the biggest organization is definitely the Asexual Visibility and Education Network, or AVEN. You can just go to asexuality.org to check them out. AVEN is actually an international organization. It is not incorporated formally and is not a 501c3, but has a huge presence, and the ACE Community Survey actually spun off of AVEN, and each year the ACE Community Survey collects over 10,000 responses, mostly from the US, but actually from all over the world, to get a better sense of the idea of who are asexual people, what are the societal, the stigma, the health issues facing them, and it's just an amazing undertaking that they do with absolutely no funding, just out of passion, because there's no one else doing the work and it's very needed. And then there's also ACE Week, or ACE Awareness Week, sometimes as it's called. This year, it will be October 23rd through October 29th. aceweek.org is the website, and there's there are a variety of asexual activists who who are involved with AVEN, or who are involved with the community survey, who are involved with ACE Week. There's a variety of local groups around the country that call themselves AVEN chapters, sometimes on Facebook, although it's sort of not really a formal term, because AVEN is not a incorporated or formalized organization, as I was saying. There's also other groups that, ACE is Wild in New York City, that, they're local meetup groups or other types of activities. There's newsletters that are out there, but again, what you're seeing is not much formal infrastructure. And what I want to also highlight is that there's not a single bisexual or asexual community organization in the country that has a full-time paid staff member. And that has been true for asexual communities always. And there's been a brief time when one BIPLUS community organization had an executive director for less than a year, I believe, and then that went away because it was not sustained with fundraising that matched the need to be able to provide a full-time salary. And so that stands, that's maybe not surprising given the Funders for LGBTQ Issues dollars breakdown that we saw earlier, that and that's also why we started the Visibility Impact Fund, is that bisexual and asexual people are underrepresented strikingly in LGBTQ community efforts, and also in NIH funded and human health research initiatives. There's, despite seeing, and especially with bisexual people, more and more evidence that BIPLUS people might be experiencing worse health disparities than people of other sexual orientations. There still has just not been a scaled up response to address any of the issues that bi and ace people face, and especially in the health domain or elsewhere. So I think that really takes us back through our studies. So we had our overview. We talked about the demographics of bisexual and asexual populations. We talked about biphobia and acephobia and how they're measured. The health of bisexual and asexual populations. We didn't go through course readings yet, because we'll do that when we meet together, but we did talk about the different intersections and identities that exist. And then we talked about asexual and bisexual community resources and how they are often underfunded and understaffed. But it's also really important, because I think the way that why did we end with community? I think because within community is where we can start to find some of the solutions that will be needed to address and improve the quality of life and health and equity for bisexual and asexual people. It's going to come from within us to help be the solution. Without communities, without community empowerment and voice and presence, if we think back to that conceptual model, we're not going anywhere. And so I do have hope, despite difficulties, that we can come together and fight back and improve outcomes with dedicated focus and resources that we just need to keep on building. to address the issues that we just talked about. All right, well, thank you so much for your attention. And with that, I'm going to stop the recording and, yep, have a good rest of your evening, everyone.